Welcome to another AAPA PANCE PANRE Review Quick Case. My name is Paul John. This is John Maybe.
Hi.
And let's get to today's question.
All right.
So, a 46-year-old man who is otherwise healthy comes to the office for his annual flu shot. Which of the following patient education statements is the most appropriate information to provide this patient regarding influenza vaccination? A, 5 to 10% of people who receive the vaccine will develop high fevers and myalgias. B, the vaccine is contraindicated in people with a food allergy to peanuts. C, the vaccine is not a live virus and cannot cause the flu. D, the vaccine will cause a mild flu, but the clinical manifestations will not be serious. Or E, the vaccine will protect him from all influenza virus strains for this particular season. John, what's the correct answer, and what kind of question is this?
Sure. So the correct answer is option C. So here we're taking a look at the vaccine is not a live virus and cannot cause the flu.
Got it.
So the kind of question this is another one of these health maintenance type of questions, but this one is directed at patient education. So do you know like the components about whatever it is you're going to do or whatever it is that you're going to ask the patients to do?
So they're expecting you to be an FAQ.
Right,
Got
exactly,
it. Okay.
right? Just click on the button and you get your answer.
That's right.
So let's take a look at these other options. Option A is 5 to 10% of people that receive the vaccine will develop high fevers and severe myalgias. So it turns out most people, if anything, you get like a little bit of maybe some localized redness and tenderness at the injection site,
Right.
but you really don't see like the high fevers or the myalgias with this. It's a pretty rare occurrence. There is, as you likely know, a small number of people, or there's an association with the development of Guillain-Barré syndrome that may be
Feared
associated.
complication.
Yeah. Right. So people talk about the CDC mentions a number of 1 to 2 extra cases per million per year. So
Very
again,
rare.
Yeah,
Got it.
very rare.
Okay.
So you want to just be aware of that. Option B, the vaccine is contraindicated in people with food allergy to peanuts. So actually, the injection of the vaccine is developed from they use a small amount of egg protein, ovalbumin in particular, in the development of this vaccine. So people with a history of egg allergy potentially can get a reaction to this. So the amounts that are used in development of this vaccine is so minute now that the likelihood of developing a reaction is very slim.
So they say only for serious egg allergy, people with like anaphylaxis, you may want to consider observing them for a period of time after they administer. But I believe there's also a recombinant version of the flu vaccine that doesn't have or involve any egg.
Right. So we're kind of in this transition period now where we kind of still have some of the older, technology and the new technology, like you said, doesn't use albumin at all. So the correct answer we just went through, option C. So in influenza virus, like we alluded to already, is actually it's an inactivated virus and or it's grown in cell culture. So because you're really injecting the antigen only, right?
Yeah.
That's inactivated. You're not going to get any symptoms. So this is really the question here is really targeted at like a misconception. I think that patients may frequently come in with is if they get the flu shot, I'm going to get the flu or get some mild symptoms, as a consequence of that. And then that is not the case.
There is that live attenuated influenza virus. I think that's a spray, the nasal spray, right? But that's different from what this question is saying, which is the shot.
Exactly.
So there is the shot. None of the shots involve the live attenuated influenza virus.
So here we're talking about the injectable version of the vaccine.
Sneaky.
Option D is kind of like a derivative of C, but here we're talking about mild flu and maybe some clinical manifestations. So again, we're talking about using inactivated virus, so we're not going to get any disease from this. And the last one, the vaccine will protect this individual from influenza strains for this all influenza strains for this particular season. And of course, that's not true, right? No. The vaccines are really kind of targeted at the most likely antigen. And, epidemiologists use like data to try to predict what's going to be the flavor of the season. And, hopefully that covers it. So the vaccine effectiveness really does vary from year to year and amongst different age groups and different risk groups.
Makes sense.
But that's not the correct answer. So there you go. Example of a patient education type of question.
All right. And that wraps it up for this quick case.
All
We'll
right.
see you next time.